In the new therapeutic strategy, it was for the metastatic renal cell carcinoma. We had only 1 or 2 drugs, and they were not very useful. We had for patients with a renal cancer no really sufficient therapy. Since the last year, for Austria, we have the so-called multi-kinase inhibitors. The multi-kinase inhibitors work directly on the tumor cells and on the blood vessel cells. Therefore, they inhibit the growth of tumor cells and also of the blood vessels, and this is the work or the kind the multi-kinase inhibitors are working. These are drugs the patient have not to go to the hospital and have infusions. They can take the medicament orally. So it is very fine for the patient and for the quality of life for the patients that they have not to stay in the hospital. So we have to define the patient, is he in a poor risk group, intermediate risk group, or in a good risk group, and is it a first therapy or is it a second therapy after progression of the tumor. And there is an algorithm, and for each these part there is a different therapy for the patient. This drug does not only work for renal cancer, it also works for hepatocellular cancer, for example.
Liver cancer is the 5th most common cancer in the world, and unfortunately oftentimes the cancer is discovered too late. And if it's discovered too late, we do not have the option of treating it by surgery or by interventional therapy. And until very recently, we had really no options to treat liver cancer in this stage. So we are very happy that this year a new drug came to the market that was able to treat liver cancer for the very first time very effectively. In my own experience, and I've experienced with quite a few patients on liver cancer, this drug is well tolerated, and if they have side effects, we can manage them very easily on an outpatient basis. It has been shown in a very large multi-center international study to improve survival of the patients significantly, which means by 40%, which is almost an incredible increase for any oncologic treatments.